Hello, my dear friends. How are you? I am sure you are always fine. Myself is Professor Dr. Deshpande. Today is the 25th of April 2019 and we are back in the serial Ayurveda for all. Let the Ayurvedic knowledge make viral and it should spread to nook and corner of the world. We are talking about the basic principles, basic physiology, basic understanding of Ayurvedic science. We are making all of us aware of the basic terminology of the Ayurveda so that whenever you talk about any pathological condition, whenever you talk about any disease condition, you are well familiar what is dosha, what is dhatu, what is mala, what are their properties, what are their functions. So these are the very fundamental knowledge that whenever you want to have the Ayurvedic treatment for yourself, whenever you want to learn something about Ayurveda, you must have the basic understanding of all these terms, terminologies, definitions and concepts. Dosha, dhatu, mala, moolam, hi shariram. Dosha, dhatu and mala, bioenergies, 7 tissues and 3 major waste products are like the roots of our human life. Like the roots give the nutrition, existence, then maintenance and decaying process in the tree. Similarly, whenever the dosha, dhatu and mala, bioenergies, tissues and waste products are giving life to us, they are responsible for our birth. They are responsible for the quantity and quality of life. And they are the only responsible for the death. Somebody will surprise, these elements are responsible for birth and these responsible for the death. How it is possible? In a simple way, I can give one very interesting example. Sun is responsible for the light and sun is responsible for the darkness. Try to understand very quiet and comfortably. Sun is responsible for the light and sun S-U-N is responsible for the darkness. How? Very simple. Because when sun is there, we get the light. When sun is not there, we don't get the light. Simple thing. Similarly, whenever dosha, dhatu, mala are in physiological state, we are living. When dosha, dhatu and mala are in extreme pathological condition, bad stage, then they can endanger of our life. We can die even sometimes. Yes? So, my dear friends, we are talking about the shrestha karma of dhatus. Very important, fundamental. Do you understand the function of each dhatu? Vagbhat has explained in Ashtanga Hridaya text. This is the Samhita Grantha, compendia of the Ayurveda. Charaka, Sushrut and Vagbhat. These are the names of the scientists, Rishis, as well as these are the names of their text. So, what he is saying? Prinanam, Jivanam, Lepaha, Sneho, Dharana, Purane, Garbhot, Padashta Dhatunam, Sreshtham, Karma, Kramat, Smrutam. Kramat in a sequence. Prinam is a function of Rasadhatu. Jivana is a function of Raktadhatu. Lepana is a function of Mausdhatu. Snehana is a function of Medadhatu. Then Prinanam, Jivanam, Lepaha, Snehanam, Dharana. Dharana is a function of Asthi Dhatu. Purana is a function of Majja Dhatu and Garbhotpadana is a function of Shukra Dhatu. Today we will concentrate on Asthi Dhatu. Asthi Dhatu is nothing but the bones, osseous tissue inside our body. So, my dear friends, from the top to bottom, there are the different places where bone is inside your body. We cannot see the bones because bones are covered with the muscles. Bones are covered with the fatty tissue. Bones are covered with the skin. So all these layers and inside it there are bones. For example here, let us see here, brain. How we can understand where are the bones? Just make the X-ray, radiological examination, CT scan. then you will understand there is a cranium. Okay, cranium. Then here, whenever the person die and all the muscles and all the upper layers go out, what is there is a skeleton. Then you can find where is the mandible, where the maxillary bone, where is the frontal bone. So there are lot of bones on this face. Then here is a clavicle, collar bone. Then my arm, it contains the humerus. My forearm contains the radius and ulna. Here also you have the carpal bones, metacarpals, carpal, metacarpals, phalanges. Here also you have the bones, phalanges. Then in the chest there is a bony cage. There are the ribs. Okay. Then if you go down, then there is a pelvic girdle, pelvic bone in the lower part of your trunk. There is here on the back side, there is a vertebral column, inside which there is important organ, that is spinal cord. Then in the thigh muscles or inside the thigh muscles, there is a femur. Then in your leg, there are tibia and fibula, twin bones, tibia and fibula. Then tarsals, metatarsals and phalanges. So these are the different names of the Asthi Dhatu or the osseous tissue or the bone. And all these bones, each and every bone is doing, of course, one function, dhru dharayati, to hold, to maintain our human physiology, our life. Similarly, prinanam, jeepanam, lepaha, sneho, dharana. Dhru dharayati is a function of each tissue, but dharana is a more specifically function of the osseous tissue. How? Let us see. If any bone is get fractured, try to understand. If, for example, my humerus is get fractured, how I can maintain the function of my arm? No, it is not possible. I cannot lift my arm. I cannot write. If my radius and ulna are fractured, in the old age, common fracture is radius and ulna. Then Kuli's fracture is there. So the person is becoming handicapped. Whenever, wherever any bony part, any bone is fractured, which is diagnosed by our X-ray, radiological examination, CT scan, rib fracture is also possible. Traumatic, most of the time it is traumatic in origin. That means there is some, what you can say, the trauma externally. There is a road accident. You fall down from somewhere and then different parts of your body get damaged, but basically bones get affected. How you can diagnose that the bone is fractured? Very simple, two things. You cannot make the normal movements of that part, number one, and there is severe pain and of course severe tenderness. When doctor wants to touch that bone, oh no, it's not possible. That is called as a tenderness. So pain, tenderness and loss of movement of that part is indication that the bone is fractured. Whenever there is a fracture, whenever there is a dislocation, many times the shoulder joint, it gets dislocated. Temporomandibular joint get dislocated. So dislocation, moving from that normal position, can also make a problem of maintenance of that particular organ. So in short, what is the function of dharana? Dharana is a maintaining the normal anatomy, normal physiology of that particular part. Remember, cranium is maintaining my anatomy and physiology of that particular part. Humerus is maintaining normal anatomy and physiology of my arm. So whatever the functions, flexion, extension, rotation, contraction, dilatation, whatever the musculoskeletal functions are there, locomotive functions are there, that will be maintained by the osseous tissue, by the bones, bony joints, ligaments and tendons. All together they are responsible for the maintenance of anatomy and physiology of that particular organ. This is called as dharana. Another important aspect, bone contains lot of calcium and phosphorus. So our teeth are maintained, our hairs are maintained. There is an appendages of the upadhatu of the asthi dhatu or the osseous tissue. So remember calcium and phosphorus. If there is osteoporosis, if there is osteopenia, then there is a accidental fractures or the unnoticed fractures in your back muscles or in your backbones, rather I can say. So vertebral fractures, cracks will be there, rib cracks will be there, pelvic bone problem will be there. So osteoporosis, osteopenia can give you the pain in the neck region, pain in the back region. You cannot walk, you cannot sit. What is that? You are to examine the bone density. Bone density checking is very important. Serum calcium level examination is very important because that is that dharana function of osseous tissue. If there is osteopenia, osteoporosis, that dharana function has been damaged. If serum calcium level is low, dharana function has been lost. So I hope, my dear friends, I have tried to explain you how that dharana function is nothing but the maintenance of anatomy and physiology of that particular region or of that particular organ. Ribs are protecting to my lungs and heart. If that rib fracture is there, naturally there will be problem in normal functioning of my heart and lungs. There will be inspiration, there will be pain because rib fracture is there. Although it is not directly connected to the heart and lung, indirectly they are protecting the heart and lungs. So my dear friends, dharana function of osseous tissue is very important for the quality and quantity of our life. That is all for today. I wish you all the best. Please take care of yourself and see you soon. Please don't forget to subscribe my YouTube channel. Thank you very much.